Good morning, and thank you for being here today with us. I'm Sarina Roher. I'm a proud registered nurse and honored to serve as president of Oregon Federation of Nurses and Health Professionals, AFT Local 5017. I'm here with OFNHP member Josh Oppenheim, a physician's assistant, who I asked to join me today to share why he will be on strike with nearly 4,000 of the 4,900 Kaiser healthcare workers that we represent. Our bargaining teams representing nurses, lab professionals, therapists, social workers, and many others spent months at the bargaining table pushing Kaiser to agree to real solutions for safer staffing so patients get the attention that they deserve, competitive wages, and to respect the clinical expertise of those on the front lines who know what quality care requires. It's disheartening that Kaiser has refused to engage meaningfully, not only at our local tables, but across the Alliance of Healthcare Unions, where we bargain for 63,000 members nationwide. Kaiser cannot cry poverty. We all know their profit margins, which sit above Amazon's at nearly $13 billion. Yet they continue to hold back competitive wages here in the Northwest, where many of our members trail behind hospital wage scales, some by 25%. This paired with similar barriers that other Alliance siblings from coast to coast are experiencing, it leads me to one conclusion. Kaiser CEO Greg Adams is not prepared to settle contracts that are equal or equitable for all Kaiser employees. Contracts should be grounded in the very value compass in the labor management partnership that Kaiser once proudly claimed to be its foundation. So we are calling on Kaiser to stop stalling, break the silence at the bargaining table, and return with serious counterproposals. It's time to return to their roots by working with the healthcare workers who make this mission possible. From the very beginning of the partnership through the pandemic and crisis after crisis, it's been the healthcare workers who carry this system through. Even now, as we brace for the potential impacts of federal cuts, our members remain committed to patient care and the success of healthcare systems. And that commitment is reflected in the proposals at the table. We remain ready to reach an agreement. None of us want to strike, but when we face unsafe staffing, turnover, moral injury, and we are silenced at the front line, we have a duty to speak up. We are not walking out on our patients, we are simply standing up for them. The strike will last 5 days unless Kaiser reaches a fair and honorable settlement that respects my members, serves our patients, and strengthens our communities. We welcome our community to join us on the picket line each day from 7 a.m. to 6 p.m. While this is very serious and we don't take a strike lightly, we intend to show up to the strike line every day with the same joy, love, compassion, and dedication that we bring inside those buildings to our patients. We are ready to return to the table, Kaiser. It's time for you to catch up and step up and do the right thing.
Good morning, everyone. My name is Josh Oppenheim. I'm a primary care physician associate, a PA here at Kaiser. Like so many of the members around me, I came into this work because I believe in quality patient care, the kind of care that ensures every person who walks through our doors gets the time, attention, and respect they deserve, the kind of care that ultimately leads to real healing. In recent years, Kaiser has made our jobs harder, and it's only getting worse. Our schedules are packed, often with complex patients who've been inappropriately triaged. We've tried to raise the alarm about the time we're given to care for these patients, but our concerns have been largely ignored. When we speak up about patient safety, about preventing clinician burnout, we're met with silence, and that silence is deafening. We need templates that reflect reality, visits that give patients the care they need when they need it. But right now, we don't have the freedom to use our clinical judgment to shape what that care looks like. Experienced clinicians must have a voice in how patient visits and daily templates are structured. We know what our patients need, and we know what quality care requires. Instead, Kaiser demands we see more patients in less time, while the support we need to stay afloat disappears. As salaried employees, we don't just clock in and clock out. We're often working on our own time, with Kaiser exploiting our exempt status. On average, our bargaining unit members donate 4 extra hours of work each week to ensure our patients get the care they deserve. That means missed breaks, lost time with our families, and the charting that spills into the evenings and through lunches. This isn't sustainable, not for us, not for our patients, and not for the future of healthcare. When staffing falls short and wages lag behind, it becomes harder to recruit and retain the skilled providers our patients rely on. If this continues, we'll see longer wait times, less access, and care that feels rushed and impersonal. And let's be honest, we're Kaiser patients too. We know firsthand this isn't the kind of care that anybody wants. That's why we're here today. Striking isn't something anybody wanted. That being said, when Kaiser refused to do the right thing, doing what's right for our patients means standing up and saying enough. We've been negotiating for months. We've been advocating for years. Now we're showing Kaiser what we're willing to do for our patients. For 5 days, we're standing united. We're showing Kaiser that we're serious, that we're ready to fight for a healthcare system that works for caregivers and for the communities we deserve, or that we serve and deserve. So let's stay strong. Let's stay together, and let's make it clear. We're out here because we care. We're out here for our patients, and when we fight together, we build the kind of future they deserve. Thank you.